Well, March is Social Worker Month, and to bring awareness to this issue, we're taking a deep dive into mental health in high schools during this pandemic. The high school district's lead social worker, Kim Reynolds, tells 23 that her team has been making more house calls than ever before due to lack of student engagement during this distance learning period.
Students who were struggling with school pre-pandemic, let's say due to social anxiety, are now doing well. Staying at home and doing, that virtual environment. And then those students who are doing well at school pre-pandemic are now struggling kind of due to more of that social isolation.
23 ABC's Kristin Vartan spoke with one student who has struggled during the pandemic and how she got through it.
When you're alone, you feel like, oh, no one sees you, no one cares. I might as well just, end it all. It's really hard to get those thoughts off of your head.
In December, Ridgeview High School freshman Zira Brown says she tried to harm herself, but her sister found her before it was too late. Zira was then admitted into the hospital after talking to her therapist. She was there for 4 days. It was there she realized she had something to live for.
In the hospital, I was helping the other kids. They were listening to me, and I was giving them advice on what to do and, how to calm down. And I think that's really good that I'm starting YouTube to help those kids coming from a peer that is still going through it and trying to get through it.
One of the practices she says that helps her, a distraction technique called the ABC game.
You pick a topic and you're like, oh, for instance, things that make you happy. So for A, art makes me happy. For B, my grandpa's name was Ben, Ben makes me happy.
The Kern High School District's Director of Student Behavior and Support, Brian Metaborough, says they do have resources available virtually until KHSD transitions to in-person learning.
Think of school psychologists, mental health clinicians, and school social workers as being 3 mental health professionals on each campus, plus counselors and behavior intervention staff. We just want kids to know they're not alone, the supports are there, and we can obviously follow up with action plans that are meaningful and are very student specific.
Some of those action plans: virtual small groups, house calls, home visits, emails, and texts. Some practices that can help with depression and anxiety, Kim Reynolds, a licensed clinical social worker and lead social worker at KHSD, says are limiting social media to a couple hours a day, especially before bed. Self-care, breathing techniques, and exercise, she says, help too. But most importantly, reaching out.
People are feeling the same way that they are feeling, and by communicating their worries and listening to others, it divides the burden and increases connection.
KHSD has begun training and discussing what in-person mental health resources could look like for students in April and May.
We're talking about coming back possibly to more in-person instruction. Those students are going to need that extra support. And so it's going to be all hands on deck.
Meanwhile, things are looking up for Zira. She has engaged in socially distanced cheer practices with members of her squad at the park.
Honestly, when I go to practice or when I go to the park to practice our cheers, it distracts me from all of my thoughts.
And that was